We just reviewed the dorsal to palmar and the lateral to medial views of the carpus. It is important to recognize the limitations of these views, in that the carpal bones are superimposed on each other, which makes it very hard to see individual bones and the surfaces of those bones. This is where the oblique views of the carpus can help us further define the location of different bony lesions. Before we look at the oblique radiographic views, we want to revisit the couple of surfaces that we are going to use to take them.
We had the dorsomedial, the dorsolateral, the palmarolateral, and the palmaromedial surfaces of the carpus. These are the surfaces that we are going to use to position our beam source and our plate for the oblique views. In the DLPMO, or the dorsal lateral to palmaromedial oblique view, you can see that our X-ray beam source is going to be positioned on the dorsal lateral aspect of the carpus, and our plate is going to sit on the palmaromedial surface of the carpus. If we look at the radiograph we obtain with this view, and remember our rule that the surfaces in profile are going to be opposite the name of the view, we see the dorsomedial and the palmarolateral surfaces in profile. When we go back to our bony anatomy and we ask ourselves what bones sit on the palmarolateral surface and what bones sit on the dorsomedial surface, we can start to interpret this view. The fourth carpal bone is located on the palmarolateral surface and articulates with both the cannon bone and the lateral splint bone. Some clinicians will say that this articulation forms an uppercase T, with the base of the T here and the long part of the T here. We see the dorsomedial surface of the radius and the proximal and distal row of carpal bones. There are some chip fractures that are often located on this surface that can be seen in this view. The accessory carpal bone also has a distinct appearance in this view due to the obliquity of the shot, and you may hear some people say that it looks like a baseball catcher's mitt in this view.